Bonjour, good day. Thank you so much for being here. Want to start off with some comments. Since 2016, 27,000 Canadians have lost their life because of a toxic supply, because of an overdose. And those are lives that have been taken from us and lives that we could have saved. Today, I want to talk about our bill being put forward or to a vote, Gord's bill, which calls for three really clear things. We want to see a health-based approach instead of a criminal-based approach to people dealing with substance abuse issues. And so the first thing is we want to decriminalize the approach. It should not be that folks that are dealing with these struggles are faced with a criminal approach. Secondly, we want to make sure that we have a national strategy around safe supply. We know that we need a safe supply to respond to this serious crisis that we're up against. And finally, we also want to see expungement to help people who are struggling with the stigma and to erase some of that stigma. Really, what we're calling for is a evidence-based, health-based approach to save lives. And it is unimaginable to me that that the Liberal government can see the evidence that the current approach is not working and refuse to support our health-based approach, particularly when the Liberal government has just approved an exemption for BC. What does that say about the rest of Canada? What does that say to the thousands of families who buried their children because they were lost to a toxic supply or to an overdose situation? What does it say to the rest of Canadians that their lives don't matter? It's shameful, frankly, to not take a national approach to a national crisis. The Prime Minister has to show leadership here. We can save lives today. The bill that we're presenting will save lives, will mean a significant difference in this fight against the toxic supply and the overdose crisis and the opioid crisis that is gripping our country. We are at a precipice today. We can make a decision to save lives for the future, or the Liberal government can continue to choose the status quo, the same approach, which will have the same result. People will lose their lives needlessly. So we again are calling out for justice, principles, and an approach to save lives, which is to implement the exact same exemption that the government just did yesterday across the country. Support our bill that is fully backed by evidence. Health experts agree. This will save lives. This is a better approach. If we want to make sure that we don't lose another 27,000 or more Canadians, those lives will not be lost if we take a different approach. And that's what we're calling for today. Aujourd'hui, je veux parler de notre motion, un projet de loi proposé par Gord. On est tellement fiers de Gord pour proposer cette motion, cet projet de loi. Et c'est quelque chose qu'on appuie comme parti parce que c'est une approche pour faire face à la crise opioïde qui va sauver les vies. Depuis 2016, on a perdu plus de 27 000 personnes à travers le pays. Ces personnes sont des Canadiens qu'on aurait pu sauver leur vie. Mais l'approche du gouvernement sur cette question de crise opioïde, c'est une approche qui ne fonctionne pas. On propose une approche de santé au lieu d'une approche de criminaliser les gens. C'est une approche qui est appuyée par les experts en santé. Et on exige le gouvernement d'appuyer notre projet de loi pour sauver les vies. C'est une approche pour faire quelque chose, trois choses en général. Premièrement, de décriminaliser la possession des drogues personnelles. Deuxièmement, c'est d'effacer les records criminels pour les gens qui ont possédé les drogues pour les donner une nouvelle vie, plus des opportunités et pour éliminer le stigma. Et finalement, d'avoir un plan national sur la question d'accès aux drogues non toxiques. Ce sont des éléments forts, appuyés par les experts, qui vont sauver les vies. C'est une question de qu'est-ce qu'on veut faire. Est-ce qu'on veut continuer avec la même approche qui ne fonctionne pas et le résultat, c'est les gens perdent leur vie? Ou on peut prendre une approche de compassion, une approche une approche scientifique, une approche de santé pour aider les familles, pour aider les gens et sauver les vies. Ça, c'est la question aujourd'hui. On a vu que le gouvernement a récemment annoncé une exemption pour la Colombie-Britannique. Oui, c'est bon pour la Colombie-Britannique, mais qu'est-ce que ça veut dire pour le reste du pays? Qu'est-ce que ça veut dire pour les autres provinces et territoires où on a le même défi, le même problème, la même crise? Est-ce que le gouvernement va dire que c'est d'accord que les autres provinces et territoires, les gens peuvent perdre leur vie et on ne fait rien? C'est complètement inacceptable. C'est pourquoi on a encore dit clairement que notre approche, c'est une approche appuyée par les experts et qui va sauver les vies. Et encore, on dit qu'on doit appuyer le projet de loi. Encore, je veux remercier Gord pour son leadership. And so I want to again thank Gord for his leadership in bringing this bill forward. This is truly a bill that will save lives. And I want to pass the mic to Gord now. He'll talk about a bit more about the impact of this bill and then introduce a mom who will share her story about a tragic loss in her family and how this bill might have saved, in her case, saved a life. Thank you so much, Gord. You're up next.
Well, thank you, Jagmeet. And, last year, the federal government struck an expert task force, Health Canada, made up of experts on substance use, including the Canadian Association of Police Chiefs, medical health professionals, people who work on the front line of this crisis, people with lived experience and people who use substances, Indigenous leadership. And they all were unified and unanimous in that they agreed that criminalizing people who use substances is causing more harm, and it needs to end. They made it unequivocally clear that people that have been charged with personal possession of substances, that their records needs to be expunged because it is a barrier to housing, employment, to travel, to child custody. And the stigma alone is killing people in terms of criminalizing people. And they made it very clear that there is no silver bullet to this crisis, that it requires a comprehensive, multifaceted approach because it is a complex issue. And they cited that we need a national strategy. And the national strategy needs to include a safe supply, access to a safe supply, treatment on demand, recovery, education, and prevention. And the federal government has let that report sit and collect dust for over a year. The bill today that will be voted on is a reflection of the expert task force recommendations. And it's a national approach because we know incrementalism kills when it comes to the toxic drug supply crisis. We know that the current patchwork across Canada isn't working. Yesterday, we heard another announcement of further patchwork in Canada. Now, that was definitely a step towards stopping the harm of failed drug policy. But it shouldn't be up to local governments and provincial governments to deal with this crisis. This is a national issue. It's a federal issue, and it requires leadership. It requires leadership now. What we're asking for today is for the government to pass this bill, to get it to committee, to listen to the experts. But what we're hearing is they're actually going to vote against this bill. And, I have a huge problem that the Prime Minister doesn't want to hear from experts, the same experts, the same science and evidence-based decision makers that guided him through COVID-19. He doesn't want to listen to them when it comes to substance use. So the stigma starts with the Prime Minister. It's not just in his inability to take action in a timely fashion and deal with this, not crisis. This is a health emergency, but also in the amount of money he's allocated, $100 million over 3 years, $30 million a year for 10 provinces and 3 territories. I'm sorry, that's not enough to respond to this crisis. So the Prime Minister and his inaction is costing lives. And as Jagmeet made it very clear, our leader, who was the first leader to come out and support a health-based approach to substance use, that, policies can't stop at the Rockies, that the lives of the families of the people that have been lost on the other side of the Rockies need to be heard. They matter. Their communities matter. 72% of the lives that have been claimed by this epidemic have been on the other side of the Canadian Rockies. And the federal government has an opportunity today to pass this bill, get it to committee, so all parliamentarians and leaders can hear from the experts themselves. And I hope they'll do the right thing. Otherwise, they're going to have blood on their hands. It's unacceptable and irresponsible for this government to take a patchwork approach to a national health emergency, and they need to declare this a national health emergency. It's my honor and privilege to turn it over now to Christine Nayler, who lost her son to this poison drug supply, who's from this side of the Rockies, and she'll be able to share a bit of her story. Thank you.
Yesterday, I traveled with a group of mums to Ottawa so we could be present today when MPs voted on Bill C-216. A year and a half ago, I did not know any of these mothers, but now we are forever bonded through a shared, unimaginable grief. This is the real-life impact of our government's failure to act on a public health emergency, the loss of life. 27,000 is not just a statistic. It is the number of Canadians we have lost to toxic drugs. These were real people. These are our children. These were sons and daughters, brothers and sisters, and their lives mattered. Their losses have forever impacted the lives of their loved ones, and ripples of grief continue to spread through every community in this country. I would like to share with you who some of these beautiful souls were. I'd like you to meet the children of the mothers I traveled to Ottawa with. Angela shares of her son, Jordan. Jordan loved hard and broke harder, but what he will never be forgotten for is his courageous spirit, his loyalty, and his generosity. He was a true friend and a loving son. His memories continue to light up the room with laughter or to inspire strength and compassion. Cheryl speaks of her daughter, Shailyn. Shailyn was embraced by the beautiful Native culture. She loved to dance at ceremonial powwows, and she was a precious butterfly dancer. She often sought guidance from her elders when she struggled with life, and she had great respect from where she came from. She loved her family with such a beauty. And Irene shares about her dear Roger. Roger's charismatic personality, beautiful smile, and warm heart won steadfast love and friendship every step of the way. Roger came to know true joy in recovery, but he relapsed one night and tragically died from a toxic supply. And now I'd like to introduce you to my Ryan. My Ryan was a gift to our lives and to the world. Ryan was a gifted musician and writer. He had the IQ of a genius and the soul of a poet. He had beautiful Irish eyes that smiled. He was an old soul with the heart of a child. Ryan was highly educated, earning both a honors bachelor's degree and a master's degree before he became ill with bipolar disorder. Ryan got sick while he was living alone in Edmonton, and he self-medicated with alcohol and then later with street drugs to cope with his illness, as the pharmaceutical medications did not work for him. Sadly, we lost Ryan 1 week before his 35th birthday due to a toxic drug poisoning. This is why I stand here today. I stand here today to appeal to our elected MPs to support Bill C-216, to send it to committee for study and debate. What our country needs is not half measures or pilot projects. We need countrywide, comprehensive, health-based approach to address this public health emergency. We need one that includes education and prevention, treatment and mental health supports, safe supply, and decriminalization. As a mother, forever changed by our country's failed drug policies, from the bottom of my heart, I stand here before you today, and I beg you, for Ryan, for Jordan, for Shailyn, Roger, and for the thousands of Canadians that are struggling every day to stay alive, I ask you to please support Bill C-216. This is not a partisan issue. This is a public health emergency. I ask you to come together as you did with COVID-19. The cost of not supporting this bill is too high. We are losing a whole generation of Canadians. I will leave you now with this quote by Gary Haugen to think about. When our grandchildren ask us where we were when the voiceless and the vulnerable in our era needed leaders of compassion and purpose, I hope that we can say we showed up and that we showed up on time. I beg you, please show up. Thank you.
I just want to really thank Ms. Nayler for sharing her thoughts, those stories, putting life, breathing life into the people that were lost, to remind us that these are real people. It's not just a statistic. So thank you so much, Ms. Nayler. With that, on est prêt pour vos questions, ready for your questions.
Okay, we'll start with question in the room, David.
Hi, David Thurton, CBC. You said that the government is taking an incremental approach, a patchwork approach. You can make that argument for a lot of things, like mandatory minimums is another example of that. What do you think? Why do you think they're taking that approach? Is it that they're afraid of being branded, of being too radical? Or is it maybe that some places in Canada aren't ready for the wraparound supports that you would need to bring in, decriminalization?
Well, one response right off the back, if they can do it in British Columbia, there's absolutely no reason why they can't do it in other provinces. Decriminalization is the simplest thing. It's a criminal matter, criminal code matter, which is absolutely federal. There's no justification at all. In fact, it's more complicated to have different laws in different provinces. How confusing is that? In this case, there is no justification for the patchwork approach, where in one province, people will be treated with a healthcare approach in BC, but if you happen to live in another province, you could be criminalized. There is absolutely no justification for that, and Gord just has an additional point to add on that.
And I'll also say, like, in terms of if this is truly a health issue, it needs to be treated as such. And there's patchwork right across the country in terms of also leadership. In Alberta, you require ID to use a safe consumption site. In Saskatchewan, they're selling T-shirts to fund prairie harm reduction, the safe consumption site. In Manitoba, there isn't any. Christina's son died. He was on a waiting list for treatment, and they rejected him because he was on charges for drug-seeking related crime. This isn't okay. We need leadership from the federal government. This is a federal issue. And instead, they're downloading to local governments. They're downloading to provinces that don't have the power and authority. And we need them to take action. We need the Prime Minister to lead on this issue. Where's the federal response like they had with SARS, like they've had with COVID-19? They're not applying that here. 27,000 people have died, and they're going to let more die. And the patchwork is in safe supply that they talk so highly of, in treatment where they're barely, rolling out any resources to support that. Provinces are saying they need a federal partner to respond to this crisis. And it requires federal leadership, absolutely requires it.
If you just will allow me to switch gears here, my colleague Elizabeth Thompson broke a story about the number of orders in council, so cabinet orders that were issued that were labeled secret. And it turns out that there have been a significant number of those, more than what we've seen in previous governments like the Harper government. I'm wondering if your party thinks that this says anything about the transparency and openness of the Liberals, and also, I guess, what impact does this have on trust in government when there's so many people who are quick to jump to conspiracy theories and half-truths and misinformation and disinformation?
I'll pick up on the last bit of your question. The context that we're in right now, it is more important than ever for us to have trust in institutions, and to establish trust, it requires transparency. And the story that broke outlined that there have been more secret decisions being made in cabinet than even the Harper government, which at that time was considered to have done a lot in secret. That is absolutely problematic. That erodes trust in institutions, and it is an example of a hypocrisy where the Liberals had claimed to be interested in transparency and now are showing in action that they're not. We will continue to push back and say that this is the wrong approach, that we expect decisions to be made in a transparent manner, that secret decisions or decisions that have national security, where there may be justified explanation for why they're not being made in a public setting where there's a national security threat, they may exist, but that has to be used very judiciously, not commonly. And what we're seeing now is an increasing reliance on this in-cabinet approach, which is problematic, something we disagree with. We want to see more transparency, and we want to see people able to trust their institutions because they see the decisions being made in a transparent manner.
Alex Ballingal with the Toronto Star. Just going back to what you guys came here to talk about. Obviously, you've made it clear this is a life and death issue. You've also made it clear that if the Liberals end up as expected to vote against this, they have, as you said, Mr. Johns, blood on their hands. So is this serious enough, given that you see it as a life and death issue, if they vote against it, to be a deal breaker for the confidence and supply agreement?
We've always laid out that our agreement lays a foundation for things that we were able to push and fight to achieve, and we were able to achieve some significant victories for people. It was never intended, nor do we expect it to be a ceiling or a limit on what we can push for. If this government chooses not to move forward on a health-based approach, particularly when they've made that exemption for one province, the decision is on them. They made this decision. They are making a bad decision. They have for a number of years. They were in a majority for a number of years and did not change their approach to dealing with the overdose crisis, the toxic supply crisis. They continued to operate with the same approach that had the same result for years. We're providing an alternative vision. If they choose not to follow that, that is their decision, and they are wrong for doing that. The Prime Minister is wrong for not acknowledging that if the past approach has not worked, you can't continue doing it. And we're laying out a path supported by experts, supported by the government's own experts, in fact, backed by evidence. And we've got an emotional appeal from a mom who shared stories of children that were lost, that did not need to be lost. We are saying that this is the government's decision if they choose to take the wrong path. We're going to continue to fight to say we need to save lives, and here's a path to save lives.
Just on a separate matter, that going back to sort of a transparency thing as well. This morning, the public inquiry into the use of the Emergencies Act put out a statement that said that they've asked the government for access to information that might be covered by cabinet confidence and other privileges, so cabinet secrets related to the decision to invoke the act. Would you want the government to provide that information and potentially waive cabinet confidence so the committee as well that's studying the issue can see that material?
Yes, our position around the Emergencies Act is we need to have full transparency. We need to know the evidence that was relied upon. We need to know what information cabinet had and why this was proposed. We believe it was the right thing to do, but we also believe in transparency. It requires a full and thorough analysis of the decision, what led us to get to that point, and a number of other factors we really want to uncover, including the support of police and military personnel in supporting the occupation, active police that were supportive, or if not, turned a blind eye to clear transgressions that were going on. We wanted to understand in a wholesome way what went down and lessons that can be learned from it. So absolutely want transparency, and we want as much information as possible so we can do a very thorough analysis of what led us to that point.
Fraser?
Fraser Needham, APTN National News. So your party has said that this particular piece of Prime Member's Bill, if passed, would benefit specifically like racialized and also Indigenous communities. Can you maybe expand on that for me a bit, please?
Yeah, so what we've seen so far is in any crisis, the most vulnerable are the ones that bear the brunt of it. We saw that with any healthcare crisis, with COVID as well. Lots of evidence that those that were poorer, those that were working class, those that had to show up to work in person, racialized Indigenous communities were harder hit. Similarly, with the crisis that we're up against, it is the most vulnerable communities that are hardest hit. And so an approach that decriminalizes, focus on rehabilitation, support services, having a safe supply, giving people the support they need, will inherently protect and support those that are hardest hit. And that's why we think that this is the right thing to do. It will save lives, and it will save the lives of those most vulnerable. Yeah.
And just to add to that, I mean, the stats are pretty clear that in my home province of British Columbia, it's 5 times more likely to die if you're Black or Indigenous. In some cities, it's 8-fold. I just did a 12-city tour to stop the harm, to talk about my bill. And I was in Saskatoon, where, in Saskatchewan, they went from 169 deaths in 2019 to 464 deaths last year, more than double in 2 years. And over 50% of the deaths were Indigenous people. So this disproportionately impacts Indigenous people, and it needs to stop. And, you know, speaking to that, it just in terms of deaths and the mounting deaths in my home province, it's the leading killer between the ages of 19 and 39. It's more than homicide, suicide, motor vehicle accidents combined. And it disproportionately impacts Black and Indigenous people.
Question, but just to expand upon how expungement of criminal records would help these communities.
Expungement is really about people that have substance abuse disorders, have dealt with substance abuse issues, having a criminal record on top of the healthcare concern they already have. And with the criminal record, it precludes people who have healed, who have moved past, or who want to move past from getting access to healthcare. Gord gave an example of a treatment plan or treatment center that would only accept people who didn't have active charges. And so someone who is dealing with a substance abuse disorder will then not be able to get access to treatment just because they have a conviction or a record for the very problem that they're trying to deal with. I mean, that makes no sense. We know that it denies people the opportunity to find work, for employment, for education. And so all these barriers only make it harder to get healthy, only make it harder to get help, and only make it harder to find, to move forward with life. And so it's compiling a problem with an additional barrier, an additional stigma. And so expungement is just an incredible way to lift that burden off the shoulders of people who are trying to move forward. I worked a lot in defense, representing as a public defender, representing some of the most vulnerable communities. And we saw how much the existence of a conviction just created so many challenges in life. Like everything in life is so much harder when you've got a conviction. And so this expungement will really make a big difference in the lives of people. And again, as we know, the criminal justice system disproportionately impacts racialized and Indigenous lives. And to have that record expunged would be in the spirit of reconciliation, in the spirit of the disproportionate incarceration of Indigenous people, the disproportionate incarceration of racialized people. This would really help limit the impacts of a criminal justice approach to people who are dealing with a health problem.
Hi, Mr. Singh. Mackenzie Gray with CTV. I was just reading your deal you made with the Liberals, and in it, there's nothing in there that talks about this issue about safe supply or anything. When you were negotiating the deal with the Prime Minister, did you bring this issue up? And if you did, what did he say to you as to why it did not make it into the agreement?
And this response applies to many, many topics. There were a lot of things that we wanted in the agreement that the Liberals didn't want to do. They're a different party. They have a different approach. We wanted to do a lot more around healthcare. We wanted to expand funding for healthcare. We wanted to change our electoral system. We wanted to make sure that we were investing more in housing, more for people. The Liberals didn't want to do that. So to reiterate, this agreement is a foundation. It's a starting point. It's what we could achieve. We push for a lot more. I've long called for a healthcare approach to the crisis of opioid and toxic drug supply. We've called for that. We've raised that as concerns in our discussions and our negotiations. The Liberal government didn't want to. Unsurprisingly, they're even now faced with a bill where we've got evidence from health experts, we've got evidence from families, where we know this is going to save lives. They're still refusing to do it. So we're going to continue to fight. We're not going to back down. And we know there's a lot of areas where we disagree. The Liberals will continue to allow people to die, have an exemption in one province, and let the rest of the country continue to suffer. And that's the Liberal government's decision. That's evidence of the fact that they don't take this seriously, that they would allow a patchwork approach when they have the power to implement a national approach. And they should show national leadership. So there's many examples where the Liberal government did not want to go where we wanted to take our country in terms of providing more help for people, lifting up the people who need help the most. And we'll continue to fight for those areas that were not included in the agreement, because we know that there are so many areas that people need help on. The agreement is some incredibly significant steps forward, but there's so much more help that people need. And we're going to continue to fight for those things that will make people's lives better.
One Alex's question to you earlier, it doesn't sound like this is a deal breaker for you, that you want to continue to go forward with the deal that you have with the Liberals. Mr. Johns said something fairly substantial, that the Prime Minister has blood on his hands. You just said that the Liberals are continuing to allow people to die. How can you do a deal with someone who has blood on their hands and are allowing people to die? Is this not an issue that should be further up front for you in something like this?
When it comes to what we've achieved in the agreement, these are things that are going to make people's lives better. We're moving forward on dental care. Kids under 12 are going to get their teeth fixed this year because of the work that we've done as New Democrats. We're going to see steps forward on pharmacare so that people will not have to worry about the cost of their medication. Concrete steps forward. We've been able to achieve concrete steps forward to make sure people can find a home they can afford. These are significant improvements in people's lives. Things that we were able to achieve in a minority government. Canadians chose 2 minority governments in a row, 2019 and 2021. Instead of threatening an election at every moment of disagreement, we thought, what can we do with our power to get people help right now? We've got people dealing with the impacts of a pandemic, the cost of living going up, and a war in Ukraine. In that context, Canadians told us, get to work to help us out. Send us the help we need. We listen to Canadians. We're delivering help. But that does not mean that this government's off the hook. This government's doing things that hurt people. Their approach to the climate is completely wrong. Their approach to this particular problem that we've raised is wrong. It's been wrong for years. It's been wrong when they were in a majority government and they had the time to do something about it. They didn't. They failed to act. For a full mandate, they failed to act despite clear evidence that their approach was not working. And now we've raised a solution to the problem. If the Liberal government doesn't act on this solution, it's the Liberal government's fault. It's the Prime Minister's fault. If they choose not to listen to their own experts that say, we need to decriminalize, we need safe supply, we need to have rehabilitation and support services for people. If they refuse to do that, that is a Prime Minister's responsibility, that is a Liberal government's responsibility, and it is their weight to bear.
I think it's good.
Yeah, I just want to add that, like our first private members bill that we put forward was this bill. So in terms of priorities, this is our caucus was united behind this bill. And the Liberals have a chance today to do the right thing, to vote in support of this bill and get this bill to committee. And their own expert task force, members of that task force yesterday wrote an open letter calling on the federal government to support the bill today, to get this bill before committee so that politicians can hear from the experts themselves instead of ideology, deciding the future of how we respond to this crisis. It needs to be expert based and driven by experts in science and evidence.
Erica Ibrahim, the Canadian Press.
Yes.
I understand your point that a patchwork system is unacceptable as a federal response to the toxic drug crisis. But if the Liberals don't support the bill put forward by Mr. Johns, I'm wondering to what extent you would be satisfied with them taking the approach that the Prime Minister said that they had to take with BC before accepting their exemption request, namely putting systems in place, safer supply, drug checking services, supervised consumption sites. If that's sort of the route that they take, how satisfied would you be with that?
This kind of goes back to Gord's point, that's not leadership. That's waiting for provinces to act and then saying, we'll respond to you. Why wouldn't a federal government in charge of federal laws like the criminal code, acknowledging the evidence that criminalizing people for personal possession just doesn't work? It doesn't save lives. It doesn't make anyone's life any better. What it does do, clogs up the criminal justice system, uses resources. There's a cost to inaction. The lives lost should be enough reason not to delay. The fact that lives are the major cost, but there's also additional costs. There's money, millions and billions of dollars that get spent in the judicial system unnecessarily. This is a federal law, the criminal code. We could change the criminal code, which applies across the country. So none of these arguments really make any sense when we look at the criminal code. It is national. It applies nationally. We don't have a separate criminal code in each province. We made that decision as a nation that the criminal code applies across the country. So there's really no justification for any notion that an exemption in BC makes sense and to leave the rest of the country where personal possession can be a criminal offense. That makes no sense. There is no justification in wraparound services. There's no justification about existing programs or not. The criminal code applies across the country. And to say that we're going to criminalize people if you live east of the Rockies is somehow okay, but we're going to apply a health-based approach in BC. As much as I love my province and I want it to be, and I think this is great for BC, it makes no sense. There is really no justification. And if there's a lack of services in certain provinces, wouldn't you want more leadership then? Like if people are dying in other provinces because there's no provincial leadership and they're not asking for the right things, wouldn't then the federal government, who has compassion or cares about these lives, say, hey, we need to step up here. There's no provincial leadership. And it's a federal matter anyways. I mean, there is no way that the Prime Minister can justify inaction in this circumstance, given the exemption that was just passed in BC. It literally makes no sense to exempt one province and not the rest on a matter that is a criminal code matter and a matter of saving lives by changing into a healthcare approach or maintaining a status quo, which we've seen the results. More people will continue to die.
And I just wanted to pivot to a question about vaccine and mask mandates. I'm wondering what your party thinks about the mandates for the House of Commons. They're set to expire soon. Does the NDP believe these measures should be extended, and if so, for how long?
We've long taken this approach, and I think it's a very important approach that we want healthcare experts to make these decisions. They shouldn't be a political decision. There's many things that are political decisions, and there are certain things that should just be clearly what is the best case, what is the best evidence for people's health. And we're seeing a growing concern that people are wondering whether there is a true evidence-based, health-based approach to decisions. And I think that's a fair concern to be raised. And we should also apply the same rules to ourselves, make sure that it's health-based, evidence-based, and that's the best way to move forward. I really believe that people need to have confidence in our institutions, and to have confidence, we need to have decisions that are being made based on the evidence, based on public healthcare experts' advice, and that we're following that advice as best as we can.
Michel? Bonjour, Monsieur Singh. Michel Sabat de la presse canadienne.
J'ai manqué des questions en français.
Oui, c'est ça que je me disais. Alors, Monsieur Trudeau, ce matin, a envoyé un petit peu le signal que son parti va voter contre ce que vous présentez. Qu'est-ce que vous lui répondez alors qu'il dit il faut y aller par étapes, il ne faut pas y aller avec un coup de baguette magique canadienne, qu'il propose une approche plus graduelle? Et d'autre part, si vous partagez l'opinion de votre député sur le sang sur les mains, je vous invite à les réitérer.
Oh oui, bien sûr. Si le gouvernement ne vote pas pour cette motion, ils vont avoir le sang sur les mains, sans doute. Parce que cette motion va sauver les vies. Cette motion propose une approche basée sur la preuve, basée sur les opinions des experts en santé publique qui disent clairement qu'on ne peut pas continuer de criminaliser les gens qui font face à la dépendance. On ne peut pas continuer d'ignorer le problème des drogues toxiques. Et on doit proviser, on doit finir les drogues non toxiques pour sauver les vies. C'est clair, toutes les experts sont d'accord. Donc, l'idée que le Premier ministre a proposé qu'on doit prendre des mesures graduelles n'a aucun sens dans une question des lois fédérales, des codes criminels. Il n'y a aucune raison pour avoir une loi différente, effectivement, en Colombie-Britannique et une loi complètement différente à travers le pays. On a décidé d'avoir des lois fédérales sur les codes criminels. C'est une loi fédérale. Ça veut dire qu'on ne doit pas avoir des lois différentes dans les provinces ou territoires différents. Particulièrement sur cette question de possession des drogues personnelles. Il n'y a aucune raison de ne pas avoir cette même règle, cette même loi à travers le pays. Ça veut dire quelqu'un qui fait face à la dépendance dans une province va avoir une complètement différente loi que les gens en Colombie-Britannique. Effectivement, ce que le Premier ministre veut dire, il dit, c'est on va sauver les vies en Colombie-Britannique, mais on ne va pas sauver les vies dans les autres provinces. Pourquoi? Si on sait, les mêmes experts proposent, c'est vraiment les mêmes choses à travers le pays, effectivement à travers le monde, qu'une approche criminelle ne sauve pas les vies, n'aide pas les gens qui font face à la dépendance. Pourquoi on continue avec cette même approche? Il n'y a aucune raison de faire ça. Je rejette absolument cette propos du Premier ministre. Il n'y a aucun sens de faire ça. On doit avoir une approche de décriminaliser, avoir des accès aux drogues non toxiques, avoir une approche de réhabilitation. Ça doit être notre approche pour sauver les vies. Comme j'ai dit, 27 000 personnes ont perdu leur vie depuis 2016 et ce sont des vies, ce sont des frères, des sœurs, des filles, des fils qu'on aurait pu sauver. Donc, c'est pourquoi on dit clairement que non. Il n'y a aucun sens de dire qu'on doit prendre des mesures graduelles. Dans ce cas, non, pas du tout.
On voit que ce projet de loi vous tient clairement à cœur. Premièrement, est-ce que c'est susceptible de mener à déchirer l'entente avec les libéraux? Et d'autre part, est-ce que vous regrettez de ne pas avoir inclus des dispositions à ce sujet-là permettant de passer un tel projet de loi dans l'entente en question?
Dans l'entente, ce qu'on a fait, on a utilisé notre pouvoir dans un gouvernement minoritaire pour obtenir des résultats, des victoires pour les gens. Dans un contexte d'une pandémie, la hausse le coût de la vie qui augmente et une guerre qui effectivement nous rend un peu moins sécuritaires à travers le monde. Dans ce contexte, on a dit comment on peut utiliser notre pouvoir pour aider les gens. Et on a essayé d'inclure plusieurs choses, beaucoup de choses que les libéraux ont rejetées parce qu'ils ne sont pas un parti progressiste comme le nôtre. Et ils ne sont pas un parti qui veut prendre des mesures audacieuses pour sauver les vies et pour rendre la vie plus abordable. Ils sont un parti différent. Ils ont des priorités différentes aussi. Donc, ce qu'on a obtenu, c'est vraiment une base. Ce n'est pas une limite de ce qu'on peut obtenir et ce qu'on peut advoquer. Donc, on va continuer de mettre la pression pour plus d'aide, pour plus de gens. Et dans ce cas, on a un exemple d'une approche claire qui peut aider les gens, qui peut sauver les vies. Et si le Premier ministre, si le gouvernement libéral n'accepte pas ce projet de loi, cette approche, c'est leur faute, c'est leur responsabilité. Et donc, quand les gens vont continuer de mourir à cause d'une approche qui ne fonctionne pas, c'est la responsabilité du Premier ministre qui gère le pays, c'est la responsabilité du gouvernement libéral qui sont dans une position de pouvoir pour faire les changements nécessaires.
La dernière question sera en ligne. Hélène Buzetti.
Oui, bonjour, M. Singh.
Bonjour.
Je vous amène tout à fait ailleurs. Cet après-midi, le Bloc québécois fait voter une motion qui condamne les ratios de diversité dans l'attribution des chaires de recherche. J'aimerais savoir ce que vous en pensez de cette motion et pourquoi.
On peut faire un contraste aujourd'hui. Nous allons voter sur notre motion, une motion qui va répondre à la crise opioïde, à le fait que 27 000 Canadiens ont perdu leur vie depuis 2016. Ça, c'est notre priorité. Sauver les vies des gens qui font face à la dépendance, qui sont dans une crise à cause de la crise opioïde. Et le Bloc va voter sur un enjeu ce n'est pas un vrai enjeu qui frappe le Canada dans un contexte aujourd'hui de crise climatique, l'augmentation du coût de la vie, la crise opioïde, la crise des changements climatiques. Dans ce contexte, dans une pandémie, dans un moment où on a une guerre en Ukraine qui rend le monde moins sécuritaire, dans ce contexte, ça, c'est le contraste entre le Bloc et nous. Nos priorités, c'est pour aider les gens, pour parler des vrais enjeux qui frappent le monde maintenant. Le Bloc, on peut voir leurs priorités et on va voter contre.
Mais je comprends que vous n'estimez pas que c'est une priorité, mais c'est néanmoins mis aux voix. Vous ne m'avez pas répondu sur le fond. Pourquoi vous n'aimez pas ça? Pourquoi vous allez voter contre? Bon, vous dites que ce n'est pas une priorité, mais à Québec, par exemple, ça fait beaucoup jaser cette idée qu'un poste ne soit pas qu'un homme blanc ne soit pas autorisé à postuler sur un poste de chair. Alors, j'aimerais entendre votre argumentaire. Qu'est-ce que vous n'aimez pas à propos de la motion du Bloc?
Alexandre Belleris, notre député à Montréal, a présenté un beau argument. Il a parlé du fait, si on veut changer les faits qu'il y a des communautés qui ne sont pas représentées dans n'importe quel secteur, n'importe quel emploi, n'importe quel endroit, on doit changer les politiques pour encourager plus de participation. Il a donné l'exemple de participation des femmes en politique et il a montré comment l'augmentation de participation, c'est presque 2%, entre 1 ou 2% par année. Et il a montré comment ça va prendre presque 40 ans pour rendre l'équité, l'égalité hommes-femmes en chambre de commun. 40 ans pour avoir, si on continue dans la même façon. Donc, pour avoir des changements, pour plus de participation, on doit faire des choses différemment. On doit avoir des politiques qui encouragent les gens qui ne sont pas représentés dans n'importe quel secteur. Donc, pour moi, ça, c'est une bonne idée. Je veux voir plus de participation des gens qui n'ont pas une voix, qui n'ont pas une opportunité. Et je pense que c'est une bonne façon d'augmenter la diversité des opinions, des participations. Et les résultats sont meilleurs pour les gens quand on a une représentation qui est plus diverse, inclut plus des femmes, plus des communautés vulnérables.
Ceci met fin à la conférence de presse. This concludes the press conference. Thank you.
Merci, thank you.
Thank you so much. Thanks, man. Really, I can't say enough. Thank you so much, Dustin.